Hello, I'm Dr. Lynda Dean-Duru. I'm a board-certified pediatric laser dentist located in Ashburn, Virginia. I've been practicing and caring for children as a specialist for over 20 years. I'm here to talk with you today about restricted airways in children and how I use my iCat imaging machine to detect this. Does your child suffer from any of the following concerns? Snoring, mouth breathing, teeth grinding, bedwetting beyond potty training age, inability to concentrate at school, having diagnosed with ADD or ADHD, having behavioral issues, tossing and turning in bed, or having trouble sleeping. It is possible or even likely that one or more of these concerns could be a symptom of a severe medical condition related to restricted or compromised airway and could be as serious as obstructive sleep apnea. Did you know many consequences of compromised or restricted airways in children are preventable with timely diagnosis and treatment? When diagnosed early by trained sleep and airway professionals, this condition can be improved without medication or surgery. And it is preventable. Did you hear me? It is preventable. As a specialist in pediatric dentistry, my team and I spend a minimum of 80 minutes each year examining your child's oral health and airway. That's 98% more time than your pediatrician. Oftentimes, many of signs of restricted airway are observed in the face and mouth way before serious symptoms arise. So, what are some signs that help us become aware of any airway issues? Some of the signs that tell us and give us a clue that a compromised airway could be some hyperactivity when we see the child coming into the office. When we see them, they have dry chapped lips. It means they've been mouth breathing for a while. We can also tell they're worn down teeth. They've got narrow jaws. They've got crooked teeth. They've got an overbite and underbite. They've got a cross bite. That's that kind of crooked kind of bite, cross-side bite, I could say sometimes. They got a tongue tie or lip tie. And they got jacked up scalloped tongue. That's the way you chew up your sides of your tongue like I do every morning when I wake up from grinding my teeth. And they've got a whole lot of cavities when they don't even eat a lot of candy. Sometimes we know that they've got reflux that have chopped away a lot of their teeth as well. Just to name a few of the things that we see in the mouth. The longer it takes for a child to get their airway diagnosed and treated, the more permanent the health issues become in adulthood. I am a prime example of that. I have been mouth breathing for as long as I can recall. I even remember I had a friend of me in high school that made fun of me while I slept with my mouth open. Oh my God. At that time, I was upset and offended. Today, it turns out she made an early diagnosis. Who would have known that? Because 5 years ago, I was diagnosed with sleep apnea. And now I have to use a CPAP machine every night. Every night. With my diagnosis, and knowing I could help my young patients avoid such health risks now, this is the main reason I decided to invest in the iCat 3D iFlex machine. Modern medicine has moved to 3D imaging of the body. Dentistry is moving toward 3D images as well. And we are happy to be the first pediatric dental office in the DC, Maryland, Virginia area to offer the iCat Flex 3D imaging to our patients. In less than 5 seconds, 5 seconds. This award-winning technology allows us to take the image of your child's head, face, and airway anatomy, including the TMJ and wisdom teeth, to help diagnose their airway growth and detect other potential problems. Think about that. 5 seconds. It can help you find out your child's airway and help you prevent this potential adult health risk of obstructive sleep apnea. Help you so they don't have to go to bed with a CPAP machine every night like I have to. Think about that. It is preventable when a trained sleep professional is able to diagnose them. So, what is a compromised restricted airway? This image shows when a child's airway is narrow or restricted. The child will struggle to get enough oxygen to their brain, especially at night, and they will resort to mouth breathing or snoring, which will make matters worse. Here, this ICAT shows an unrestricted airway. Think about that. This whole white area shows good open airway, which means this child or this person is able to breathe very well through their nose and gets enough air to their brain, which helps restore and replenish them overnight and makes them grow well, and they're able to thrive, wake up refreshed the next morning, and they can do well at school, thrive and grow and do well academically and athletically. So what you're looking for is to be able to diagnose early. And when you diagnose early, you can treat. And the goal of treatment is to be able to grow the airway using multiple gentle holistic approaches. And when you're young, it's easier to treat than when you become an adult. Please subscribe, like, and comment. Look out for more informational videos from me on integrative pediatric dental health topics. If you think your child may be having trouble sleeping, staying awake, breathing, or you are interested in proactive preventive dental care, please call our office. Mention this video for a complimentary airway screening. Up next, I will be discussing a hot topic: breastfeeding, tongue-tie, and the importance of integrative approach for treatment. Please send your questions. Until next time, take care, be safe, and keep breathing.